We would like to welcome all of our viewers and listeners to another Road to Wellness webinar. I'm Kathy Olewski, the Road to Wellness webinar host, and I bring the patient perspective to the webinar series this year. I'm in the 7th year in remission off treatment with ANCA vasculitis MPA, and I hope to help the Vasculitis Foundation bring awareness to this disease. You know, over the past year, the Vasculitis Foundation provided a series of webinars on the topic of COVID and the vaccines for COVID-19. In February of this year, we hosted another great webinar on COVID-19 and answered as many questions as we could during that webinar. And today we're honored to have Dr. Kenneth Warrington to answer additional patient questions from that webinar. Dr. Warrington is a consultant and serves as the chair of the Division of Rheumatology, Department of Internal Medicine at Mayo Clinic in Rochester, Minnesota, with a joint appointment in the Gonda Vascular Center. Dr. Warrington is also the director of the Vasculitis Subspecialty Group. He joined the staff of the Mayo Clinic in 2006 and holds the academic rank of Professor of Medicine, Mayo Clinic College of Medicine and Science. And Dr. Warrington's research and practice interests are in the field of vasculitis, particularly large vessel vasculitis. He conducts clinical and translational research and has published extensively on their diseases. Welcome, Dr. Warrington.
Thank you so much, Kathy, and thank you for the introduction. It's a pleasure to be here and happy to talk about vasculitis.
Well, we really appreciate you giving us your time today. We had so many questions at the last webinar. We tried so hard to answer them all, but we didn't get to them all. So let's try and tackle a few more of them today. And these are questions that we received from patients. So I'm going to read them, but they're actually from other patients who I can definitely identify with. So if it's okay, we'll start with the first question.
Absolutely.
Dr. Warrington, can you talk about what it has been like for you over this past year dealing with COVID-19 and the crisis and trying to maintain a normal work life, seeing patients? Like, what has been the biggest challenges for you and your patients over the past 14 months, and any particular lessons that you want to share that came from this pandemic?
Well, thank you for that question. Of course, this past year has been completely dominated by the COVID-19 pandemic, and it's hard to believe that it's really a whole year has gone by. March 16th, 2020 was really the day that where my son, basically his school closed, and at Mayo Clinic, I walked into work and realized that that day they had implemented changes at the front door, really to start to promote safety in the organization. And so that's the first thing that comes to my mind is when we hear about a pandemic, an infection that's spreading rampantly, throughout the country, throughout the world, the first concept that comes to mind is safety, right? And in particular, when we think about patients in rheumatology and patients with vasculitis, when we think about the threat of an infection, right away, we remember that our patients have a compromised immune system. And so in the context of a spreading infection, of course, our concern goes out to preserving the safety of our patients because they are particularly vulnerable, being immunocompromised, and then, of course, protecting the providers, the physicians and other providers that are caring for these patients. With such an unprecedented situation, a pandemic that hasn't affected us in more than 100 years, of course, none of us have lived through this in our lifetime. So the unknown brings with it fear, right? We fear the unknown. Obviously, we fear the possibility of being sick. We are bombarded by news and information. One of the things I learned is certainly the importance of accessing reputable information, because early on, and still, we feel like there's information that's being thrown at us constantly, daily and multiple times a day. And so one of the things I learned is one, the importance of being well informed, the importance of being informed from reputable sources, whether that's websites or other sources, medical information, again, from reputable institutions. And then when it relates to safety, the biggest change, of course, was transitioning from in-person medical care to telehealth. And telehealth was something new for us, something new for our patients. There was a learning curve for providers, a learning curve for patients on how to learn to interact and visit with a provider in this new electronic medium. And I think providers adapted well, patients adapted very well. I've been impressed by how patients adapted to technology, had relatives and friends help out and work with us, work in partnership to continue to provide excellent medical care in the context of the changes brought about by the pandemic. We were trying to balance what is the risk of bringing a patient in for a face-to-face visit where they may be around other people that are spreading illness, at the same time, of course, not wanting to delay or interfere with care of complex conditions like vasculitis, and trying to figure out when is it really necessary for patients to come in. And I think we learned that in some circumstances, we can still do very well with helping patients and guiding patients through telehealth, perhaps doing blood work that can be done closer to home, and then discussing results and so forth over video or phone visits. So we learned a lot about the benefits and the limitations of telehealth. So I think that'll be probably the biggest change that's going to stay with us in the medical system even after the pandemic is over. We here at Mayo Clinic and other large institutions plan to continue to provide this as a means of delivering care. And the last comment I have about this really very excellent question is dealing with uncertainty. And that, I think, has provided one of the biggest challenges because our patients have questions and we don't always have the answers. So we appreciate, the partnership and the constant communication where we may be saying we don't know because we don't have the data yet. And oftentimes we're learning along with our patients as we look to researchers, we look to our national organization like the American College of Rheumatology, and experts who are studying the virus, who are studying vaccines and so forth, and processing all that information. So again, I think we've learned to process information real time and have that very close communication with our patients so that as things change, we're able to provide helpful and meaningful recommendations.
Yeah, it's really interesting to hear your perspective of all this, because we forget as patients that maybe we forget that our doctors are human and that they're going through new things along with us. It was totally a new situation for all of us, wasn't it? It's very interesting to hear that. And if I could just jump to the next question, is there any research showing that getting COVID could also trigger a flare? And if I'm already in active disease, could the virus make it much worse? And I can tell you, every vasculitis patient had this at the top of their thought when the pandemic started.
Yeah, of course, certainly. And for patients with vasculitis, of course, we're concerned about any infection, mainly because of the risk of being on immunosuppressive medications, of course, and whether the virus could trigger a flare, because we know that when we develop an infection, when we get a vaccine, and we'll talk more about the COVID vaccine specifically, but an infection is going to rev up our immune system. So we need our immune system to be able to fight that infection. And when our immune system is being activated or revved up by an infection, it's possible that could also lead to a trigger of a flare of a vasculitis or of an autoimmune condition. Fortunately, that has not actually panned out in terms of research studies. So it remains a concern, but we have not seen that really very much play out in the clinical practice. So while there is concern, it has not really been something that we have encountered very much in the clinical practice. Of course, we want to make sure that vasculitis is under control, and we do get concerned that if patients have active disease and they were to get COVID illness, then that could be a more severe illness. And so we'll get to, talking about the vaccine, because obviously now the vaccines are the best way to protect ourselves from COVID.
Well, that's a great answer. And I know that I was a little bit scared. I did get COVID. And I remember when I was first diagnosed, my doctor talked about any major incident in your life might take you out of remission and put you in a flare. So that was, and that was the talk on the various groups that are discussing vasculitis on social media. So great answer.
You mentioned earlier that you had COVID illness, and I'm sure that was a source of concern for you. And if you're comfortable, would you be able to share with us what your experience was like having COVID?
Sure. I think anything that brings information to our other vasculitis patients is helpful. And it was scary. It was scary before I had COVID, thinking about the possibility of getting COVID. As a matter of fact, I remember early in the year last year when we started talking about all these things that I was thinking, I'd have to isolate myself to protect myself. And then I was like, oh, okay, I know how to do that. We're experts at that. So I did isolate myself and basically, as what we know happened because, or are fairly certain happened, is because I was out walking outside in my neighborhood and walking my dog, and she pulled on me and I slipped on wet pavement and broke my ankle. So I then went through, going to get my ankle looked at and finding out that I had to have surgery. And of course that panicked me because it was during COVID that all this was happening, but I got the surgery. I stayed healthy. Everything was great. After I got my boot off, I went to physical therapy. Everything was great. About 2 weeks into my physical therapy, my physical therapist office called me and told me that my physical therapist had COVID.
Oh, no.
So we were protected. We were wearing masks and I still felt like it would be okay, but I went and got a test and I had COVID. At the point that I found out that I had COVID, I had no symptoms. So, but at that point, I started keeping a journal because I've learned from other people with vasculitis that this can help. And I remember that I was very upset. I was very scared. People were dying. And I think that is like the biggest concern. We took care of, in our household, it was just my husband and myself, and he sort of moved upstairs and I was downstairs, and we were just isolating so that he wouldn't get it because I needed him to be my caregiver. And so I basically had terrible chills when the symptoms did onset, terrible chills to very bad hot sweats, very little fever for me, but I did have some fever. I had intestinal issues, and I'll just kind of leave it at that. For me, I really, at the end of all of the symptoms, I felt like I had gotten a mild case, and I had been very, very, very lucky. I had no cough. I did have kind of sinus stuff and aches and pains for days. I had some things happen afterwards that people talk about, the brain fog, and I had some weird symptoms where I didn't lose my taste and my smell, but smells were horribly offensive to me. When my husband was cooking, it was overwhelming, like I had to get out of the house. the smells were just so intense. And I think that kind of lasted. This happened to me, by the way, the day before Christmas. So we were very in a bubble with our immediate family. We thought we were going to have Christmas together, but we did not. So it's just what you have to do. And it's not the end of the world. You're going to see them again. And that's just a day in time. And I'm super grateful that I was not hospitalized and I recovered. It was several weeks of being severely fatigued. And I think even now, months later, I'm just so tired sometimes. And I'm not in a flare. I've been to my doctor twice, so I'm not in a flare. So it has to be the long lasting effects of COVID. But in general, I'm super grateful that I had what seemed to be like a really bad flu kind of episode.
Yeah, thanks, Kathy. And, those are excellent points. Of course, one of the challenges with this COVID illness is so much variability. Mm-hmm. And that's what we're still working on trying to understand, because some individuals have very mild illness, others have more significant symptoms, others need to be hospitalized for pneumonia. And then, of course, unfortunately, some people even lose their life to this. But when we have some understanding as far as what the risk factors are, but we still have a lot to learn. Mm-hmm. Just so much variability. And then, as you indicated, what are some of the long-term symptoms and consequences of this illness? And that's another topic of ongoing research. So thank you for sharing that. And
I actually just hope that by sharing that I can alleviate some of the worry that our community has. I was a nervous wreck the first 3 days after getting the positive COVID test, because I was just anticipating the worst. And I was sick, but I was not hospitalized, and I didn't feel like I needed to be hospitalized, but I was very close in touch with both my primary care doctor and the doctor that treats my vasculitis, and they were great. We had televisits multiple times, and they were great. And that's what you have to do. You have to trust in your medical care and take care of yourself. One other point that I would bring up, because this was extremely surprising to me, is after I had it, I thought, well, I didn't get hospitalized, so maybe I didn't have COVID, even though it said I had a positive COVID test. So I had an antibody test and it came up negative. And then I was really questioning it. So I had a second one 2 weeks after that, and it came up negative. And then when I went to Chapel Hill to see my doctor that treats my vasculitis, he says, okay, well, we're going to do an antibody test too. And it also came up negative. So, but everybody's convinced that I had COVID and that my positive test meant that I did have it, and the symptoms meant that I did have it, and that my doctor says I maybe don't build antibodies to this, maybe because of prior treatment or whatever. We don't know these things. And I will also say I have had the first of my 2 Pfizer vaccines, and I had no reaction to it at all other than a sore arm. And I'm looking forward to the second vaccine, and I'm just trudging along like everybody else in the world who doesn't know what this disease, what COVID can do, and what implications it has on those of us with vasculitis, because we just don't know.
All excellent points. Yes. And you're right. We have encountered also situations where a patient may not develop antibodies after having COVID illness, as best we can tell. And so exactly as you mentioned, it's still important to be vaccinated, because that's, a better strategy, the only strategy we have to prevent potential reinfection, which is also a possibility, unfortunately. And then the other point I'd like to make, which I think has come up for some patients, is the antibody test is really not helpful in understanding whether the vaccine has been effective or not. So up until now, there really is no blood test to understand whether the vaccine has worked or not for a particular individual. So that antibody test does not apply to people who are vaccinated.
Oh, that's interesting. I absolutely did not know that. Although I would not have gotten a fourth antibody test. I think I've been tested enough, and I'm just doing what everybody tells me to do, and I'm living a very happy, healthy life right now, and I'd like to keep it that way.
Absolutely.
The next question that we had for you is, what is the greatest risk for patients with vasculitis and the COVID-19 virus? Is it how the virus itself makes vasculitis worse, or is the treatment for COVID a particular risk for patients since we have compromised immune systems?
Yes, another excellent question, which of course we have been looking at and trying to understand what the risk is for patients with rheumatologic conditions right off the bat, knowing that patients with vasculitis have a compromised immune system because of the treatment that they're on. So it's not so much the disease itself, but rather the treatment, because the treatment, of course, compromises the immune system. Now, what's interesting is that researchers have looked, and there is what's called the Global Alliance, and they have a wonderful website. If folks are interested, it's called the Global Alliance for the Global Rheumatology Alliance for COVID-19, and patients can go on there and look at that website, and they have a lot of information. They basically, researchers have been gathering information from thousands of patients with rheumatologic diseases, with vasculitis, and who may have contracted COVID to try to understand what the impact is on those individuals. It's interesting that what the researchers found is that a lot of the risk factors for severe COVID that are seen in the general population, of course, also apply to patients with vasculitis. So in other words, if an individual is older, if that individual has other illnesses like chronic kidney disease, heart conditions, if the individual is pregnant, if there is a diagnosis of diabetes. So if a patient with vasculitis also has those other things, then of course their risk for COVID is going to be greater. And then we have to think about the risks of the vasculitis treatment. And so then research have looked, of all the medications that we use in rheumatology, are there some that stand out as being particularly risky? And the two that start to stand out some are, one, high doses of prednisone more than 10 milligrams a day, and rituximab in some individuals may lead to more severe COVID. So in those circumstances, patients should take particular caution and measures to avoid getting COVID illness as much as possible. So it relates more to the treatment of the vasculitis that may result in risks to an individual with vasculitis. As far as the treatment for COVID itself, the current treatments either consist of antiviral medications like remdesivir. Some patients may receive high doses of glucocorticoid, dexamethasone. If they're sick with COVID, some patients may receive what's called convalescent plasma, which is the processed blood of people who have been previously infected with COVID. Those treatments, as far as we know currently, don't pose any particular risk to patients with vasculitis that is any different from other individuals who don't have vasculitis. So the bottom line is the risk relates to the treatment for the vasculitis, some medications posing more risk than others. And if a patient with vasculitis were to get COVID, certainly we would treat that individual with available COVID treatments as we would anybody else.
Mm-hmm. I was just going to say that I know I've heard you and the other doctors that have done these webinars say to us that even though rituximab is a concern, as you just brought up, that we need to just be in touch with our physicians and let them help us make decisions about what's best for us. Don't just not take it, because you keep reiterating we want to treat the vasculitis. So, and this next question is a little bit about that. Can getting the COVID vaccine be risky for me since I'm a patient with vasculitis? And could the vaccine interact with my scheduled Rituxan treatment?
Absolutely. And yes, Kathy, thank you for pointing that out. Of course, these are, general thoughts about these topics, and there is a lot of variability from individual to individual because we have to balance at every step of the way the risk of the disease, the risk of the vasculitis, the risk of COVID and so forth. And so, as I said earlier, it really boils down to very close communication between the patient and the provider in terms of openly discussing risks, benefits of each situation, and that might be different today than it is, 3 months from now. So keeping that communication open is very important. In terms of the vaccine risk, so the currently available COVID vaccines, the Pfizer, Moderna, and the Johnson and Johnson, fortunately, none of those vaccines are live vaccines. So we do not have concerns regarding the risk of the vaccine, for example, triggering COVID illness. So the only reason to not get vaccinated with COVID relates to those few individuals who have a history of anaphylaxis. That's a severe allergic reaction. There are very few instances where there is a contraindication, a reason why an individual should not get the COVID vaccine. Of course, as we know, there are symptoms or side effects that are somewhat common, but fortunately they are mild and temporary and often include headache, chills, muscle aching, and so forth. But again, the risk of severe side effects is exceedingly low, and is far lower than the risk of COVID illness. And so I and my colleagues as vasculitis providers, the American College of Rheumatology, and experts in the national organization overall do recommend that patients with vasculitis, patients with rheumatologic diseases get the COVID vaccine. Now, the other part of the question is very important because then one of the discussions we have with our patients is to be mindful that certain medications may reduce the efficacy or the effectiveness of the vaccine. So, as you all know, the medications that we use for vasculitis, whether that's prednisone or other medications like methotrexate, azathioprine, rituximab, they are all designed to dampen the immune system, to dampen the immune response. When we are giving a vaccine, we want the immune system to kind of wake up a little bit and get revved up and respond to the vaccine so it can be effective. When patients are on certain medications, there is concern that perhaps the vaccine would not be as effective. And again, when we think about those medications, the American College of Rheumatology has developed a document that is publicly available on their website, specifically outlining certain medications and which ones may need to be adjusted. So, for example, methotrexate should be held 1 week after each dose of the vaccine. Rituximab is another medication where we want to time the treatment and the vaccine. Now, again, it's a very individualized decision because if the rituximab is necessary immediately or is necessary to bring the vasculitis under control, then, well, of course, we have to treat the vasculitis. We give the rituximab. But if folks are in remission and they're on maintenance treatment, then we try to time the vaccine so that the vaccine occurs within the month before the next infusion. So, for example, if somebody's getting rituximab every 6 months, then we would ideally time the vaccine to be given maybe about the 5th month, into their treatment course. And then after they complete the vaccine series, we typically wait 2 to 4 weeks before giving the next dose of the rituximab. So again, it's working with providers to discuss timing of rituximab treatments. Again, I mentioned methotrexate, and there are a few other medications that may need adjustment that I would encourage everybody to review with their provider.
Well, that's actually great to hear, because I remember when we started doing this webinar series, early in 2020, you all didn't have all those answers. You didn't know how long to hold off on certain things. So it's great that so much time and effort has been put into it so that we as patients can feel more comfortable with that information, with our doctors knowing exactly what to do.
Absolutely. And it also helps to make sure that we all give, the same recommendations. And that's exactly why the American College of Rheumatology has developed these guidelines so that we all follow kind of similar procedures.
Yeah, I love to hear that, because I was a little bit worried in the beginning, like everybody else, because the guidelines were not established yet. So I love hearing that. Well, that's it for all of our questions today. We loved you taking the time with us and giving us all these answers, Dr. Warrington. We really appreciate it. And I do think that these questions came in during and after the last COVID webinar. So it's important that we get our patients as many answers as we can. And we appreciate the Vasculitis Foundation making this possible for us and our sponsors. And speaking of the Vasculitis Foundation and our sponsors, I do want to especially thank our sponsors, ChemoCentrix, Genentech, and Amgen, for their support of our Road to Wellness webinar series. They're helping the Vasculitis Foundation provide these valuable educational webinars and support our commitment to creating patient education.